right, so we had a bit of a think around what might be unique to community services workplaces, and so DFV Workaware and the QCOSS teams together came up with some ideas, and a big thanks to participants at our last workshop and our very first workshop, who also contributed some ideas. So we know that the community services workforce includes a range of professions. So professions on the front line, such as counsellors, case managers, psychologists, support workers. It includes people in reception and administration, people in finances and human resources, management, people in research positions, and so on. So that's a really diverse range of professions within our sector. Domestic and family violence might be the focus of the work for some people in our sector. So those, for example, working for a domestic and family violence service, or it might interact with our work. So you can imagine people working for children and family services or people working for accommodation services. This is an issue that comes up a lot in the work that they do. Another issue that we're certainly aware of anecdotally is stigma. So people feeling like they can't disclose their experiences of domestic and family violence because of this idea that we work in the sector, so we should know this, we shouldn't be experiencing it. And so that stigma may be a barrier to people disclosing their experiences of domestic and family violence. A suggestion from our last workshop was that perhaps workers might become a bit desensitised to domestic and family violence through being exposed to it in their work. So they may go home and think, well, I've got a roof over my head, I can pay for my groceries, it's not that bad compared to what my clients are going through. Certainly in our sector, there are quite high rates of burnout and vicarious trauma, as well as compassion fatigue. So that's something that's not necessarily unique, but certainly something that comes up in our sector. And to balance this, we also know that there's the presence of compassion satisfaction. And if you haven't come across that phrase before, it's the flip side of compassion fatigue. And compassion satisfaction is about what people find meaningful in their work and how they derive satisfaction from the work that they do. There may be concerns about privacy. So we do know from research that's been done is that fear of private information becoming everybody's business is a barrier to disclosing in the workplace. And some community services may be quite small, and people can have those fears about a grapevine that might run there. Another suggestion from the previous workforce is that workers can experience abuse from clients as well. So they may be experiencing it, abuse and violence that way too. The next few points speak to gender drivers of domestic and family violence. So social and community services workforces are female-dominated workforces. And even in saying that, we are still male-dominated at managerial levels, and there's still actually a gender pay gap with men earning more than women in community services. So when we think about it being a female-dominated workforce, we know that more women are experiencing domestic and family violence than men. So that indicates that there might actually be higher rates of victim survivors in a workforce like community services compared to gender equal-ish workforces or male-dominated industries. And again, based on research, we would guess that in male-dominated industries, you might see more people who use violence amongst those workforces. We also know that in community services, there were lower rates of remuneration relative to other professions. So that reduces economic independence to be able to have more options available to respond to domestic and family violence. So all of that is about how gender inequity is a key driver of domestic and family violence, and gender inequality is something that is present in community services. The other thing to think about is that community services workers can be quite isolated in their work. So you can imagine in a neighbourhood centre where there may be one worker on, or someone who's on the road for home visits who may be exposed to stalking. So that's something to bear in mind as well. And finally, in addition to the variation in the types of professions in the workforce, there's enormous variation in the workforces more broadly. So the size a workforce in an organisation, where they're located. They may be metro, regional, rural, remote. They may be for-profit or not-for-profit. They may have, a human resources section, or they may have one person who does everything. And when there are limited resources available, some community services have to work really, really hard to try and develop and update and implement policy. And sometimes that capacity to do that can be really limited. So there is very little research on the experiences of domestic and family violence by workers and community services. So Basic Rights Queensland partnered with the UQ Pro Bono Centre to do a literature review around this. And if you haven't heard of the UQ Pro Bono Centre, jump on the interwebs and Google them. They're a great part of the UQ School of Law, and they provide pro bono support and partnerships with community organisations around research and evaluation and all sorts of other activities. So they're a fantastic resource for our sector. So what they found was that, as expected, there's a significant gap in the research around the experiences of domestic and family violence by workers in our sector and use of that violence by workers in our sector. But what they did find is that professions that are associated with our sector do report experiences of domestic and family violence. So what that means is there's a great opportunity for some community-led research here about experiences in our sector. They found in that literature review that experiences of domestic and family violence impacted on the work of professions in our sector in several ways. One was that work was perceived as a safe haven from domestic and family violence. So our workplaces can be, just through existing, a really key place of support for our colleagues. Another thing was around the impacts of emotional stress on work performance. And if we think about workers in our sector being already often exposed to quite distressing or traumatising stories or experiences, that's quite a heavy mental and emotional load to be carrying if there's also domestic and family violence being experienced by them as well. Another thing that was interesting was for workers in healthcare settings, a lived experience of domestic and family violence could actually be a facilitator of high levels of care of their clients. So healthcare professionals with that lived experience tended to attend more domestic and family violence related training, to self-report more, and to access more domestic violence information for the people they were caring for after those people disclosed domestic and family violence to them. And we certainly know that there can be people with lived experience in our sector as well. So we'll jump on to the next slide there, Stacey. Thank you. So before we get into the nuts and bolts of policy, let's look at why we're doing this. So the DFV Workaware team and the QCOSS team came up with 3 key reasons that we would be developing policy responses to domestic and family violence in the workplace. And a participant in our last workshop added a really important 4th reason as well. So the first reason is that most community services organisations will hold values that reflect a high level of care and support for self-determination of individuals, families and communities that we work with. So developing this organisational policy is putting those values in action for our employees and colleagues who are part of our communities. Then we also have quite a few obligations to meet. So we have legislated obligations to provide leave and to consider requests for flexible work arrangements, and to also treat domestic and family violence at work as a work health and safety issue. So those obligations are drawn from a few different industrial instruments. So nationally, we have the Fair Work Act and the National Employment Standards. At a state level, we've got the Work Health and Safety Act and accompanying regulation. We also have modern award obligations, such as the SHADS Award. And for those of you whose organisations have enterprise agreements in place, some workplaces have gone above and beyond in their enterprise agreements to include up to 20 days paid domestic and family violence leave, with additional leave at the discretion of the employer. So that's a pretty exciting development and one way of organisations really leading from the front. A third thing that we came up was leading the way. So when we put this into practice, it means we are leading the way about the very things we're advocating for, and we're advocating for communities that are free of domestic and family violence. And then finally, and this was the suggestion from the last workshop, was around staff retention. We know it can be hard to retain staff in this sector, and particularly in rural, regional and remote settings. And if we're building a really supportive work culture, that may help us to retain staff in a sector where we do have that high turnover. So if we're having really supportive initiatives around mental health, around domestic and family violence, around family responsibilities and so on, hopefully that's going to help us to retain staff.